I'm Dr. Melikian here at Kinesis Healthcare, and today we're going to show you the Webster Technique. Now, with all the extra weight that pregnant women carry around, it can place extra stress on the spine, and a lot of times that'll cause structural misalignments. Now, these misalignments do a lot more than just cause aches and pains for the mom-to-be. They can also affect how well her nervous system is functioning, and they can place extra stress on the ligaments that support the uterus as it's expanding. And when that happens, that really restricts the amount of space that the baby has. So Dr. Webster developed the Webster Technique specifically for restoring normal spinal alignment in pregnant women. And it uses chiropractic adjustments to restore normal joint motion, to take extra stress off of the nervous system, and to take any extra stress off of the uterus, thus allowing the baby enough room to assume the best possible position before delivery. Now, even though Webster Technique doesn't claim to turn breech babies, doctors that have been certified and trained in this technique do have an excellent track record for helping babies assume the head-down position before birth. In fact, it's about 70 to 85% success rate in helping the baby to have the space to turn head down before the delivery. Other studies show even more benefits to chiropractic during pregnancy, including reducing the labor time by 50 to 60% for moms-to-be, and it also helps decrease the need for interventions such as medications by at least 50%. So it's a great technique, and we're going to show you what it looks like today. So Dr. Burns, if you wouldn't mind coming over. Thank you. So Dr. Burns is another doctor here at the office, and she's about 36 weeks pregnant, and we've already done an exam with her and determined that for her it's the left side of her pelvis that's subluxated. So we're going to go ahead and show you what an adjustment looks like. So if you wouldn't mind laying on your side facing me. That's perfect. We're going to straighten this leg here, and then this one. Good. And I'm just going to borrow this hand. So don't let me do the pulling. We're just going to tug a little bit right there. Okay. So you're going to hold that and let it relax. Okay. Just going to roll it a little bit, let it relax. There we go. It moves nicely. I'm going to have you go ahead and lay on your back. Okay, so that's part one of the Webster Technique, is to restore normal pelvic alignment, and part two is actually to hold the round ligament to take off any extra stress on the uterus. So I'm going to have you point to your belly button. That's good. And we're going to find the hip here, and there. Go ahead and relax the hands. I'm just going to gently tug on the ligament. Any tenderness there?
Yeah, a little bit.
So we're going to go right about there. Okay, so we're just going to hold the pressure for a few seconds here until it releases, and sometimes we'll actually feel the baby kick and move in response. And we're starting to get a release. I'm just going to do a couple more seconds. Perfect. And that's it. So as Dr. Burns and I are both certified in the Webster Technique, and I think both as chiropractors and expectant moms-to-be, we would highly recommend that all pregnant women get their spines checked to have as healthy and comfortable a pregnancy as possible.